Let's quick do antivirals. We will give you.
Right. Wait, because my HZT is kicking in and I've only had about 145 mLs today. Feels like I'm so thirsty.
So we kind of touched on this chapter a little bit. So I want to think like 12 slides long. We're going to cover some antivirals and antiretrovirals. Antiretrovirals are to help basically treatment of HIV and AIDS. Okay. So we go through viruses, retroviruses, yada yada yada. Let's get into it. Okay. So the main kind of drug class for antivirals end in vir. Acyclovir, valcyclovir. If you see vir, it's a good chance it's probably going to be some sort of antiviral. One of the most common viral infections, besides common cold, herpes simplex, whatever it is. Fun fact, there's 12 different herpes infections. Chickenpox and shingles is one of them. So I can guarantee everyone on the planet has some sort of herpes infection in their body. Oral and genital herpes are pretty much the same thing, just localized in a different spot. So be careful doing things. Be safe. Alright? So the point of this is we can't get rid of the viral infection. Herpes infections last for life. I had chickenpox as a kid. When I get older, odds are I'm going to get shingles. It's in my tissue. It's there forever. Can't get rid of it. Thanks, Mom. So when I'm in pain in my 40s, I'll call her up and ream her out. My sister got it. And there were those things like, play with your sister. I don't want to. Just do it. Okay. Chickenpox.
Scratch each other too.
Oh, I still have sore. I still have scar tissue on my arms from scratching them off because I was like 5. I don't know any better. The oatmeal bath, oh, it was great. Good time. Anywho, so the point of this is to help keep the virus in check. Keep the viral count down. Help prevent a flare. Help prevent that localized infection. Especially in men, when it comes to herpes, they can have an active inflammation, active infection, and not show any outward signs. So it's important that you always use safe sex practices, no matter what. You want to, so any lesions want them to dry and then become crusty, and then when it becomes crusty and dried over, that means the infection's kind of in check and it's no longer looking for infective. You can't spread it when it's crusted over and it's finally starting to heal. I think we're all kind of aware herpes infections are very contagious. So the main thing you want to look out for is going to be your kidney function with this. Okay. So you want to look out for your kidney function, kind of monitor your liver, then potentially can affect your red blood cells and your platelets. So kidney, liver, increased risk for bleeding potentially. Okay. And it's going to be a lifelong treatment, right? It's not going to go away. So when I get shingles, a really bad case, I'll go in the hospital, probably get some IV acyclovir, hopefully help prevent the virus from getting worse, and I'll be able to go home, but I'll still have the infection in my body. Just will be dormant. Gancyclovir is used to help treat CMV, cytomegalovirus, one of those things you don't ever want to get. CMV is very common in immunocompromised patients. So any sort of immunocompromised patient might be on ganciclovir prophylactically to help prevent treatment. Adverse effects: liver, kidney issues, blood counts. Your antivirals, your beers, liver, kidney, blood count. Ganciclovir, liver, kidney, blood count. See a pattern? And any antiviral, check your blood counts, get your CBC, check your liver, kidney numbers. Okay? Tamiflu, I can't pronounce the other word. Tamiflu is the new one that's supposed to, it helps either prophylactically prevent influenza, or can help shorten the course of the viral infection. Okay. Basically, it helps contain the virus so your body can fight it off. So generally, shorten the term of duration of the infection. Remember, a flu can last like 1 to 2 weeks. You gotta get that aches and pains long period of time. This will hopefully help shorten the duration of the issue. So again, quick little review of antivirals. These try to decrease symptoms of the viral infection. Most viral infections we can't get rid of. We can't cure them, we can only prevent the outbreaks. Okay? Like a plan? Excellent. So again, you want to tell them the proper precautions if you're treating for herpes infections, tell them safe practices. Tell them if its effects beware, tell them signs of kidney liver failure. Immunocompromised patients, stay away from people. Drink only bottled water, stuff like that. All right. Now let's talk about antiretrovirals, HIV and AIDS. HIV and AIDS is a virus, but it's a very potent and deadly virus because of how it works. How it works is it basically rewrites your DNA. It's a retroviral. Retroactively rewrites your DNA. Ooh, thank you.
Antibiotics.
Doesn't be a lot louder sneeze than it was. It's probably a really light one. So because of how HIV actually infects the patient, that's why it's so hard to treat. HIV came out in the 70s and 80s with a lot of stigma with it, right? No one knew what it was. It was the gay man's disease. Hard to treat, high mortality rate when it first came out. It's like 5 years, you're gonna be dead. Current treatments have it down to like 2 pills a day, very cheap, very easy to monitor. If you don't take your treatment, the virus can spread quickly. I had a patient, she was transgender, HIV positive. Had a lot of issues due to HIV treatment. She wanted to stop her treatment and went palliative. She went hospice. She lasted 6 weeks before HIV killed her. Before that, she was doing fine. She had some psych issues, depression, but they said she was in her own mind. She could stop treatment. She did. 6 weeks, she passed. So it works very quickly and potently. But if treated, can be fine. Okay. So a lot of this, you know, make sure that you tell people not to reshare needles, use dirty needles, use safe sex practices, stuff like that. So what do you want to look for in your patients? We want to count their viral load. Okay? We want to see how much of the virus is actually in the body. Are we able to keep it in check? We want to monitor the CD4 levels, their white blood cell counts, their T cells. Once their T cells get to a certain point, they go from HIV to AIDS, right? When the immune system gets so low, that's when they get to actual AIDS. So the main thing, watching that viral load, right? Higher the viral load, highest disease progression, worse off for the patient. It's an autoimmune disorder, right? So it affects your immune system. HIV won't kill you, the common cold will. Okay? It's the trigger to your death. A lot of viral infections don't kill you, it's something that happens because of the viral infection that takes you out. So what are we going to talk about? Well, for us, we're not going to talk about the medications, right? But it's common for us to see a patient with HIV or AIDS. So it's up to us to kind of know things. So adherence is essential, right? 6 weeks later, my patient passed away. Routine blood work. Check your CBC, check your white blood cell count, check your viral load. Adhere to a treatment plan. Coping mechanisms, support groups, safe sex practices. Standard precautions. These are all different types of things that can be used to help prevent the virus. Not going to get them, just going to list them off so you kind of know what they are. So notice a lot of them end in that vir, right? Because they're antivirals again. Generally going to be a combination of medications to help prevent it long term. So the whole point is to slow the advance of the disease process, right? We can't cure it, we can help prevent further progression. Increase their quality of life, help maintain their immune system. And that's that. On that note,
Oh, I have a question.
There's a
Does
question.
that include like prep too for the or the, I can't even think of that.
I believe so, kind of
Okay.
same kind of thing,
Same
yeah.
kind of, all right. Because like I'm trying to, nurses get cold. Because I know like a long time ago, they used to just put you like on a short day thing.
Yeah.
You got stuck.
Well, that's different than, prep would be like for an exposure, that'd be something for, that's a little different.
Oh, okay. Yeah. All right.